My name is Jodi Jones. I had my normal scheduled mammogram, which I have every year, the same time as I have my physical. The radiologist did not like what he saw.
Jodi was referred to me after she had an abnormal mammogram for biopsy and evaluation.
I remember sitting in the examining room waiting. When she came in, she asked me, "How am I?" And I said, "I don't know. How am I? Am I clear?" And she said, "No." The diagnosis was stage 1 lobular cancer in the right breast.
She was upset obviously at first, had a hard time with that. She cried, just everything that you expect, but then she got really motivated.
When I met Dr. Hendricks, when I came in that day, she was wearing a leg brace, and I looked at her and I was like, "What did you do?" She said, "I tore my ACL." She's like, "Kickbox." And I just kind of looked at her and laughed, and I thought, she kickboxes. I'm like, okay, I have a surgeon that kickboxes. I like her a lot.
She then instantly became, what's our next step? What are we gonna do? Let's do that, let's get it done, and been very positive ever since.
When you get a cancer diagnosis, you look at things differently. The leaves are more clear, you appreciate the birds flying in the sky.
We had a long conversation about what kind of surgical management she would like to have. She was very interested in breast conservation. She underwent a lumpectomy.
I didn't expect the thoroughness, honestly. You try for negative margins. When she called me to tell me that we got negative margins, she was like, "Well, I would have expected you to be, happier, or be more excited about it." And I said, "You know why it didn't click for me to get too excited?" I said, "You said you were going to get it all." I had total confidence that there was no reason why you were not going to get the negative margins. It was basically her thoroughness. She wanted to make sure, and that really means a lot when you get that cancer diagnosis, because it's good to know that you've got that doctor in your corner. Mammograms are extremely important. The way lobular cancer is, it feeds out in like straight lines. It's not like I could feel a lump. It would never be something that I said, "Oh, well, I feel something."
There have been several large papers in the country that have decided that mammograms don't save lives. They increase cancer, they increase unnecessary biopsies and unnecessary surgeries, because maybe cancers that would have never developed and never caused anybody any trouble. The problem is it's really hard to say who that's going to be. Jodi's the perfect example of screening mammography. She didn't have a mass that she could feel really until she knew it was there.
If I didn't go for regular mammograms, I might not notice anything until there's, I guess you'd say, like a thickening of the tissue in the breast, and by that time, who knows what stage it would have been in.
And she's somebody that was able to have a breast conservation. She did not require mastectomy for her treatment because her tumor was small, and it's not something that she would have found just by simple screening exams by a clinician.
With the radiation treatment and then with the anti-hormonal medication, from what I understand, my prognosis is excellent.
She should do just fine. I have no reason to believe Jodi's not going to do great.
This is my new normal.